talking to you guys a little bit about some really important issues that are plaguing pretty much America. They're all deep rooted in the way we eat. So it's going to be a talk about nutrition, but it's also going to hit biochemistry. It's going to hit a little bit of quantum physics. It's going to hit a little bit about what are like the steps, and these are like 5 steps I would take if I had a client that had one of these chronic diseases I'm going to talk about, and to actually help either reverse or resolve or prevent these from happening in the first place. And then the other thing I'm going to talk about a little bit is some tests that they should go and consult their doctor to take to find out if they do have one of these chronic diseases or have one of these way before that becomes a serious problem. So first thing I'm going to talk about is the 2 biggest causes of disease right now in America. You guys know any of those diseases? What's the biggest cause of disease right now? Yeah, what's the biggest cause? What's the biggest cause of like death in this country right now?
Heart disease.
Yeah, exactly. It's heart disease. And what's right behind that?
I don't know. Cancer.
Yeah, exactly. Cancer. And there's one thing that is even on top of both of those things that's related to both, and actually related to almost every single chronic disease. And what I'm going to talk to you about is insulin resistance. So, first thing I'm going to talk about is how to fix insulin resistance. So, first of all, we got to figure out what insulin resistance is. So, insulin, per se, is a hormone that comes from your pancreas, and it's released every time you have a meal. So when you have a meal, this insulin actually helps uptake the glucose that's being converted in your body. So what happens with insulin resistance, your body doesn't want to uptake that glucose at all because it's not sensitive, it's resistant. And it's almost like a lock and key mechanism. Say for instance, I come here to the front door of Lift Fit Gym and I bring some random key to try to open the front door. I can't get in. However, if I bring the right key, I can get into the gym, no problem. It's not an issue. So what happens is with insulin resistance, basically you kind of are bringing the wrong key to the cell, and that's stopping you from being able to actually uptake this glucose. And the glucose, if it's just roaming around in your bloodstream, it becomes damaging to every single cell in your body. So that's kind of a little bit of an idea of like what insulin resistance is. And the first thing I'm going to talk about with insulin resistance is why do we even want to fix it? And is it even a problem? And it is. It's actually a huge problem. It's actually the big elephant in the room. It's actually linked to heart disease, it's linked to cancer, it's linked to gout, it's linked to stroke. It's linked to every chronic disease that's out there plaguing America today. Anybody have any clue how many actually Americans right now actually have insulin resistance that are over the age of 45? It's astronomical. It's absolutely insane. I would say almost every single one of your clients that has any obesity, probably at all, probably already has insulin resistance, and they don't even know it. They're like a walking time bomb. 65% actually Americans that are over the age of 45 have insulin resistance. 65. That is absolutely insane. And it's growing like in massive proportions. Right now over in China, they have over 100 million type 2 diabetics right now. And it's just growing and growing and growing. And there's one leading cause and one thing that actually what everybody's doing in all these westernized societies that's causing this big elephant in the room. And I'll go over that in a little bit. So what to fix? So we're going to try to fix 2 main things. One thing we have to fix more than anything else is metabolism. This is all related to metabolism. That's why we're going to talk about getting to the nutrition part of it. And that's why this is going to become a nutrition talk. So the first thing I'm going to go over, I'm going to show you a little graph, because I like visuals. It helps a lot to understand concepts. So first graph I'm going to show you. So what we're going to look at basically is LDL cholesterol. That's what we're going to look at, LDL. So what this graph is showing basically, as your LDL goes up, it's going to show your risk. And this is basically your cardiovascular risk. So this is your cardiovascular disease risk. So as your LDL goes up, what is your cardiovascular disease risk? Does it go up? Does it go down? Right here, I'm going to talk about a coronary artery calcium score. That's what this is on this line that I drew. So this is a score of 0. This is a score of 1,000 plus. So say somebody has cholesterol, say some curve like this. Say we have this guy right here, and we have this guy right here. This guy right here, according to this graph, he has almost a 0 calcium score. What does that mean? A 0 calcium score basically gives you like a warranty. It gives you like a 5 to 7 year warranty on whether you're going to die of heart disease or not and have a heart attack. So if I have a score of 0, that means I'm not going to have a heart attack probably within the next 7 years. That's what this score shows. This is the most predictive test that's out there in the world right now to let you know whether you have a chance of getting a heart attack or not. However, 99.9% of Americans have never gotten this test, which is absolutely insane. They actually are giving this test now to every single astronaut that has to go up out into orbit before they send them there, and they're doing it to every single president. So why are they giving this test to every president now and every astronaut, but they're not letting the common person have the same test, where it could have this type of predictive power to let you know whether you're going to have a heart attack in the future or not? So this graph is here to show you that this person that has, say, moderate LDL, this person here has moderate LDL too. But why does this person have such a high risk? This person has a score of 1,000. This means danger. This means they're going to actually probably drop dead of a heart attack within less than 5 years. That's what this high score means with this test. So this guy and this guy have almost identical LDL scores. The reason why I'm showing you this graph, I'm showing you that the predictive power of an LDL panel, of like a blood lipid panel, is garbage. It does not tell you whether you have any risk of heart disease at all. Because this guy and this guy have the exact same LDL cholesterol. However, this guy has a higher risk, this guy has no risk. So it doesn't tell you anything. So if you want to know whether you actually have a higher risk, or any of your clients or yourself or your family, your friends has a high risk of coronary artery disease, you have to do this calcium artery score. You have to do that. If you don't have that test done, then you have no clue. And what this test does is actually, it's like a high-speed X-ray, and it's a CT scan. It'll actually do the image of actually your arteries and see what type of plaque that's there already. And then it comes up with this composite score that's called a calcium score. And that's what you're getting from that score. So it's something you definitely want to look at. At the very end of this talk, I'll have like a time for some question and answers if you guys have any questions at them, but I'm going to go through this pretty fast so you guys can learn. So this is my LDL graph. And this is basically just showing like there is really no predictive power on doing a blood panel test for LDL cholesterol. So I'm going to go ahead and erase this now. And I'm going to move on to another key concept to hopefully get you guys to understand a little bit more about the root causes of disease, of heart disease and type 2 diabetes. So next thing I want to go over, okay, I want to go over a strong predictor of heart disease, which I already kind of demonstrated. One was the calcium score. That'll give you a good predictive value of whether you're going to have a heart attack or not. But these two things that your doctor can do or find out about you will be a much better predictor of all-cause mortality than almost any other thing you can find out. So next thing I want to cover, so this is just a number, any arbitrary number, and then this is blood pressure, and this is diabetes. So blood pressure, and this one's diabetes. And this, once again, this is your calcium score, and this one's your calcium score. This over here, I'm going to write red. This one I'm going to write blue. This being safe, and this being unsafe. So as your blood pressure or more people have diabetes, or if you have diabetes, it has a strong indicator, strong predictive power whether you're going to get a heart attack in the future. The reason why type 2 diabetes is such a big risk factor, if you actually already have that, you're diagnosed with that disease, is because what's going on, if this is metabolic dysfunction that's going on with type 2 diabetes. What's going on with type 2 diabetes, you have insulin resistance already. So no matter whether you have pre-diabetes, you already have insulin resistance as well. That's why right now, we have a huge epidemic right now with massive proportions with these type of diseases, because we're going to cause people to have heart attacks, strokes, cancer, all from this one thing, from having this insulin resistance that's stemming from these two factors. The more your blood pressure goes up, so if you have a client, what I do, like every time I have a fitness assessment, I do a blood pressure test on my clients. Because this test, that simple test that costs almost nothing to do, gives you a lot of predictive power whether this person has a high risk of heart disease. So that's why I like getting the blood pressure test. And like here, if somebody has a huge blood pressure, it's going to be very, very indicative that they probably have a high coronary arteries calcium score. Most likely have a high risk of dying of a heart attack within a certain period of time. So that's why it's really important to take your blood pressure. Take your own blood pressure, take your client's blood pressure, friends and family. You'll have a much better idea of whether somebody has some type of disease state already. Now I'm going to move on to the next thing I want to show you. Blood pressure is really, really predictive, but the big elephant in the room, like I'm going to keep talking about, is insulin resistance. So it's really important to understand what that really is. I explained it a little bit. We're going to go in get a little bit deeper. Okay. So insulin resistance, what's great about knowing if somebody has insulin resistance, you can do one test. There's one test your doctor can do, but they don't do it. It's a $36 test. I'll tell you why they don't do it. Because healthcare is a mess right now. If they actually can predict with good accuracy whether you have some type of disease state, that means they can't give you drugs. They can't see you anymore because they're not going to need to see you because you're going to be healthy. You're not going to need them at all. I know in the conversation you guys had a little bit earlier, it was about health insurance and whatnot. You need to be your own health insurance. Whatever you do, you need to take care of your body, you need to take care of your mind, so you don't have to see the doctor. The doctor doesn't have your best interest involved, unfortunately. When you go to see them, you usually get like 5 minutes with them or less. They actually get paid based on how many patients they see per day. So they're seeing a lot of times 50, 60 patients in a day. They don't have time to actually do a good analysis of your health. You have to do that for yourself. So the most predictive power of any different thing to know is really doing an insulin sensitivity test. They're not going to even probably know what that is, or if they do know it, they're not going to probably have you do that. What they usually do, they do a glucose test, an A1C test. It's like an average glucose reading of like last 3 months. That's what an A1C test is. What you will need to do is demand them giving you an insulin sensitivity test. That's going to tell you with 100% certainty whether you have insulin resistance or not. Whether you're starting this metabolic dysfunction, this cascade effect that could lead into a heart attack, could lead into having cancer or stroke or full-fledged type 2 diabetes. So that's what I would do first. And insulin sensitivity test, this is all this test is. It's really simple. They actually give you 100 grams of glucose, which is sugar, and then they monitor your insulin levels for 5 hours. So they take it they take it right before you have that 100 grams of sugar, then they take it 1 hour after, another hour after that, and so on. And then they can see where you're at. If it starts falling down after that initial insulin test in a nice, really good slope, just going straight down, then you're going to not have any worries at all. You probably don't have any sign of insulin resistance. However, if it goes down super slow, or it goes down just slightly slow, or whatever, you most likely have insulin resistance. You already have some metabolic dysfunction. You already need to change your diet. You already need to change some of your behaviors in order to get this from going into full-fledged type 2 diabetes. So another thing I want to go over a little bit. I'm going to go over a little bit about healthcare dollars and cents. Right now, type 2 diabetics are like the gift that keeps on giving the healthcare industry, unfortunately. Every time the doctor sees that patient, they get paid. So of course, they're going to want to see them as much as possible. So that's why I call them the gift that keeps on giving. Right now, half of our healthcare dollars are going towards treating type 2 diabetics. That's insane. However, if you do these 5 things I tell you to do, we could decrease that by as much as 75%. That would be absolutely astounding. If you could just do this with your clients, do this with yourself, do this with everybody that you come across. So I'm gonna go over those in just a little bit. But before I do that, I want to go over this Euro study. This study was actually, this came out like in 2015. It was quite interesting actually. I'm going to draw these little pies. So this is the first pie. All right, so inside this pie right here, what I'm indicating here is this is the amount of people in Europe that had heart attacks due to having type 2 diabetes. So they did this study, they wanted to see how many people actually had type 2 diabetes that had heart attacks. So these are the people that were actually diagnosed. And these are the number of people that had heart attacks in Europe. So what happened was interesting. After they tested actually the rest of these people doing a glucose test, they found out actually that 2/3 of them actually had type 2 diabetes. Because these other people right here, do the graph right here, these other people here didn't know they had type 2 diabetes. And they got a heart attack. This group here, this third group, they just didn't know that they had type 2 diabetes. Once they gave these guys an insulin sensitivity test, pretty much like 75% plus actually had insulin resistance of those people that had. These scientists that did the study, they were blown away. Oh wow, almost every single person that has a heart attack already has insulin resistance. So maybe we need to look at the root cause. Maybe the root cause is insulin resistance. It's causing all these chronic diseases. Maybe this is what we need to combat and try to help people prevent so they can stay healthy. So that's the Euro study I want to talk to you a little bit about. It's a very interesting study. Another thing I want to talk about, safe versus sick fat. So in our body, we have, like you guys probably know this being trainers, a subcutaneous fat is the fat that's right on the inside of your skin. That fat actually is good fat. That's safe. It doesn't really cause any disease state. However, the fat you need to worry about the most is your visceral fat, the ones along your organs. So one of the best possible tests you can do with your clients is doing a waist circumference test. That's more indicated whether somebody has insulin resistance than almost any test you could possibly do. And all it is putting a band around somebody's waist, seeing what their waist, and then comparing that to the average person. You can see whether, like for men, it's got to be under 40. For women, it needs to be under 36. If it's above that, you already know this person most likely has insulin resistance. And they're already at high risk for all this metabolic dysfunction that I'm talking about. So make sure you do that test. It's really, really easy. So another thing I want to talk about, let's see here. I want to talk about gut health. So when you eat any food, you put it in your mouth, it goes straight into your stomach, and then goes into your small intestine. When you process food, like for instance, I go ahead and take a watermelon, and I put it in a blender, and I just get the juice out of that, and I just drink that up. Right away, my small intestine absorbs nearly all of that juice, and right away it gets stored as fat. Because my insulin levels go up. Because what insulin does, it's a storing hormone. It makes my body want to store fat, and that's all that does. That actually can cause insulin resistance, and just changing the structure of the food. So there was a study done actually with rats. It was really, really crazy. I'm going to write down a little graph with that one. It's kind of interesting. So we had this. The study was done with these rats. They had them on like the regular chow. So this is like rat chow. And then they had them eat some high sugar and fat diet. And then this is just showing their weight gain in grams. So their weight kept going up and up and up and up the more sugar and fat they gave them. When they ate the regular rat chow, they stayed at a constant weight. However, what was really interesting about this study, all they did was refine this rat chow. They turned this rat chow into more of a floury type of form. And guess what? Their weight went up just like the sugar and fat people. It was because it was all absorbed and the structure of the food was changed. So now your body cannot absorb it the same way. It's not never going to make it to your gut. It's going to all be absorbed in that small intestine. And right away, it's going to do the same thing that the sugar and the fat does together, which is absolutely crazy. But so hopefully this is kind of building like an idea in your guys' mind about how important it is to eat whole, unprocessed foods. Once you change them, they're destructive to our bodies. It's like putting poison in your body practically. You don't want to do that. And you want to be able to express that to your clients and let them know how important it is to eat real food. Absolutely essential to good health. And you'll be able to prevent yourself from ever having to go to the doctor for these crazy chronic diseases that are just plaguing everybody. Another thing I wanted to go over. Oh, this is another cool study. That was really, really neat. We had, this is insulin, so I'm going to put an I for insulin.
It's 12 o'clock. Just
12.
to give you a timeline.
No problem. So insulin, so this is interesting. So we had these apples. We had people eat a whole apple, we had people eat juice, and we had people eat applesauce. So this is what happens. So your insulin gets spiked off the roof, basically, if you have apple juice. However, if you ate like applesauce, it's not so bad. It's still high. So this is the applesauce. And then with apples, it was much lower. It was a spike, but not crazy amount. This is just a whole apple. This is just to point out the idea again, how the structure of the food is absolutely essential. So since I'm running out of time, I'm going to go right into the steps to actually reverse type 2 diabetes, reverse the insulin resistance, and of course reverse atherosclerosis. So this is what you got to do. We have to get rid of the high insulin that's involved with the insulin resistance. So here is another graph. So here is fat, here is protein, and here is carbohydrates. So this is fat here. No, this is carbohydrates. This is carbohydrates. This one's protein, and this one is fat. If I eat fat only, I have a very little insulin response. This is insulin right here. If I eat protein, I have a higher insulin response, but it's not crazy high. And if I eat carbohydrates by themselves, especially refined carbohydrates like sugars and breads and cereals and cookies, cakes, that kind of stuff, my insulin levels go up the roof. So in order to fix this or get rid of this high insulin response, we have to eat more protein and more fat. That's what we need to do. And if we're going to eat carbohydrates, they need to be in their whole form. And then you get a spike that's not as high. That's how you actually prevent insulin resistance. That's how you reverse insulin resistance. Then your body's going to have more insulin sensitivity. So how do we do that? We have to do a low carb, high fat diet. It's the only way. And it has to be whole foods. Otherwise, you change the mechanisms of these foods, and it'll be all the same thing. Like for instance, if I ate like a hamburger, I put it in a blender and blended it up into really, really tiny pieces, my body's not going to metabolize it the same way as if I'm just chewing it up from piece to piece in that whole food form. That's one step. Second step, you need to increase your magnesium. Unfortunately, magnesium, when you don't get enough magnesium, or if you eat a lot of sugar, or you drink alcohol, it depletes your magnesium. And your magnesium is linked to atherosclerosis, getting heart attacks, and inflammation. The less magnesium you have in your body, the more inflammation you will have, and the higher chance you're going to have to get heart disease, stroke, diabetes. So absolutely essential to get magnesium. Another key element that you have to get, another key mineral, vitamin. Vitamin D. You got to get vitamin D. What's the best way to get vitamin D? You got to get in the sun. Typical Americans right now, about 80% of Americans right now are deficient in vitamin D. Absolutely essential to get enough of it. If you don't get enough vitamin D, then you're also going to be at higher risk for heart and cardiovascular disease. They did a study back in, I think it was 2013, Dr. William Davis. He gave his patients basically recommendations to get a certain amount of sun per day, and the ones that we're not going to be able to, they gave them vitamin D, they put them on a whole foods, low carb, high fat diet, and guess what happened? These patients that had heart disease, they started reversing the plaques that were in the arteries. Only study ever done that actually showed that. And it was because of these two mechanisms that were in play. Absolutely powerful. Crazy. Another thing you guys got to do, you got to lower stress. Got to lower stress big time.
Hey team, if anyone that has to go, you can. But, if not, feel free to. Yeah.
When we are stressed, our bodies absorb minerals and vitamins completely differently. In fact, the receptor sites in our body, in our gut, they don't actually work. You're not going to absorb the vitamins and minerals. So even if I get magnesium, even if I get vitamin D, even if I'm eating the right diet, I still will stay sick because of my thoughts, because of being stressed, not being in the right frame of mind. So this is absolutely essential. Otherwise, you're not going to get healthy. Actually, it's essential. You've got to do it. Last thing I want to just go over one more key thing. You got to make sure, you got to try to get this as much as possible as well. Some people don't like fish. However, fish is absolutely essential to good health. Not only good heart health, but good brain health as well. So you got to get your omega-3 fatty acids. So if you don't like fish, take an omega-3 fatty acid supplement. Make sure it's high quality. If you do like fish, try to get fish 2-3 times a day. Or not 2-3 times a day, but 2-3 times a week. And make sure it's small fish. Because the bigger the fish, the more mercury it has, and that can cause problems actually with the heavy toxicity, the heavy metal toxicity. But anyways, I'm going to conclude on one more item before I'm done. The 4 tests that actually every single person should have their doctor perform on them if they have any idea that they may have risk of any of these chronic diseases. First one is a calcium score. Second one, insulin sensitivity test. Third one, a GGT test. It's an inflammatory marker. And then fourth would be a homocysteine test, which is also another inflammatory marker. I would do those tests to see whether you have high risk for any of these type of diseases that I'm talking about.
What was the inflammatory one?
All right, now I'll go ahead and leave it open for questions and
sorry.
answers.
I,
Go ahead.
I just wanted